Great. Thank you, Liz. Welcome, everybody, to today's training on the timeline Followback. This will be considered a booster session, so we'll spend a little less time on the front end talking about kind of the genesis of the assessment itself and the basics surrounding it, and move more towards into talking about introduction of the assessment with participants and interviewing strategies. So I'm delighted to be facilitating this training today. I've found the timeline Followback to be a very useful tool and one that's actually quite enjoyable to administer as a research staff person. I've had quite a bit of experience with the measure beginning in the mid to late 90s on several clinical trials of brief interventions for substance abuse treatment, and specifically with marijuana. I'll just move to mention the training objectives for today's webcast. So one, we'll learn the purpose of the timeline Followback and some of the strengths of the timeline Followback as a substance abuse assessment. We'll talk about the benefits of this particular assessment. We'll learn how to prepare materials to administer the assessment, how to introduce the assessment to research participants, and how to guide participants through the measure. We'll also learn how to increase skill through practice and administration. So before we get started, we just have a couple of polling questions that we would like you to answer, just to get a sense of who we have on the phone today. I know there are a number of you on, and we don't get a lot of opportunity to interact, so we'll see who we have on in terms of how people have administered the timeline Followback before. Okay, and we can go ahead and show those. Oh, it looks like folks are still answering. And some of you that are on lines with multiple people, you can take a consensus of who you've got there in terms of whether you've administered the timeline Followback before. Okay, so Liz, let's go ahead and show those results.
Okay, there you go.
Looks like we have a fairly even split of about 52% of you, or 11 respondents, said that they had administered the timeline Followback before, and about 47% said that they haven't. So we've got a nice, diverse group. So Liz, let's go ahead and show the second polling question.
There you go.
So for those of you who have administered the timeline Followback before, how many of you have done so more than 50 times? Or approximately 50 times. Okay, let's go ahead and show those results.
Okay.
Okay, so we've got at least several of you on that have quite a bit of experience with the timeline Followback. And so please feel free when we open the phone lines a little later to get questions and feedback. If you have additional comments to add, please feel free to do that.
All right, I think we have one more.
Okay, so this question asks if you're working with a CTN, which protocol are you administering the timeline Followback in? And we know some of you are not necessarily affiliated with the CTN and may not be applicable. Okay.
I'll go ahead and show the results.
Great. Okay. So about half of you look like you are with another organization or outside of the CTN or not working on a protocol at this point. And several of you are working on 44 and 46. And a couple folks from other CTN protocols. Okay, great.
I'll take us back to the presentation. There you go.
All right, so let's go ahead and get started in talking about the assessment itself. So why the timeline follow-back, and specifically most of us are dealing with measures for research purposes. So the timeline follow-back is a very flexible assessment. It's flexible by time frame. You can use the timeline follow-back to gather very recent substance use data from 7 days ago, or you can go back to up to 2 years ago in terms of using the calendars to assess use. Timeline follow-back is flexible in terms of substance type. You can collect accurate data for alcohol use and any type of illicit substance use. And you can also collect a wide range of information about participants' substance use. So you can collect whether or not they used, how much they used. You can collect things like the amount of money that was spent on a particular drug in a given day. So it offers a lot of flexibility, variability in patterns of use, and in frequency and severity of use. The timeline follow-back provides a relatively accurate portrayal of substance use, and this is self-report use. You can get a range of substance use severity, and you can use this measure with individuals who have abuse and dependence on some type of substance, and you can also use it with people who have less severe use. It has good psychometric properties, and the interview format allows you to open up a dialogue with the participant and use interview strategies and memory aids that really enhance the accuracy and precision of data that's collected. The timeline follow-back can also be used and has been validated with adolescents and adults. So just a few basics about the measure itself. The timeline follow-back uses calendars to help people retrospectively estimate recent alcohol and substance use. And so the calendars are really the unique feature of the timeline follow-back in collecting self-report data from individuals. Typically, alcohol data is collected in quantities per drinking day in standard drinks, and we'll talk about that a little later on. Drugs are typically collected dichotomously as a yes or no use per day. The timeline follow-back should be administered by a trained facilitator, and this should be a facilitator who's gotten training on the timeline follow-back and also has some fairly extensive practice time with the timeline follow-back before administering it. And another unique feature of the timeline follow-back is that you really guide participants step by step, systematically, through a process of recall during the specific period of time in which you're assessing. And that will be the main focus of today's call, is really delving into that process of how to help people recall their substance use during a given period. So this measure can be used in both clinical and research settings. Primarily in research settings, we use it to collect substance use frequency and severity. It can be used as a primary outcome measure to look at changes in substance use over time. In clinical settings, the timeline follow-back can be used, for example, to probe antecedents of relapse behavior. It can be used in congruence with motivational interviewing strategies to look at people's use and talk about whether they're interested in making change. And the timeline follow-back has fairly extensive psychometric data, and it's shown to be both reliable and valid. Linda Sobel and Mark Sobel were the developers of the measure and started developing the timeline follow-back in the late 70s and early 80s. The manuals for the timeline follow-back came out in the mid-90s. And it's been validated from 1 week to 1 year for alcohol use and up to 2 years for specific substances. Okay, so at this point we're going to move in and start talking about the administration of the timeline follow-back. And we'll go through some basics of the administration and the interview process, and at the end of that, we'll open up the phone lines and see if you have any questions before proceeding. So an important part of administering the timeline fallback is the preparation, and preparation occurs before your client or participant arrives. And the main activity around preparing for this assessment is to ready your calendars for data collection. So you want to have a calendar and calendar days for each day of the assessment time period, whether that's 1 week, whether it's 30 days, 90 days, or 1 year. And on those calendars, you'll want to be very careful in putting the start and stop times for your assessment period. And this, oddly enough, is one of the most common places where errors can occur, where you don't accurately put in the correct assessment time frame. So with the timeline fallback, you always start with yesterday. You wouldn't start with the actual assessment day since it's not over. So the start day is really yesterday, and then you move back the number of days in which you are interested in assessing. And so those two dates are noted on the calendar ahead of time. You would also note any other standard holidays or other local or national events that might have occurred. You can also look back at progress notes that you've had from prior research visits with the participant and jot down events on the calendar that might have occurred in that participant's life to help jog their memory and to save them some recall. And because the calendars are the source document, we'll be writing directly on them, and you should always use ink and preferably black ink. So once you've prepared the calendars and the participant has arrived, the first step in administering the timeline fallback is to introduce the measure to the participant. And this really provides a context in starting to work through the calendaring process with the participant. So you want to go over what the purpose of the calendars is. This is kind of a unique assessment. Most self-report assessments are the interviewer asking questions and the participant responding. This is a little more active. So you want to explain why you have the calendars there. And it's really to help people remember their daily use over a specific period of time. You'll want to point out that period of time to the participant. So we're going to be taking a look at the last 90 days. You'll want to orient the participant to how long it might take. The initial presentation of the timeline fallback can be a little overwhelming, and so you want to reassure the participant that, we're going to be looking at the last 90 days, and this will take about 15 minutes for us to complete. And as with any substance abuse treatment measure or any other measure that's collecting information that can be sensitive, you want to remind the participant that the information will remain confidential. At the beginning of the timeline fallback, before you actually start the process of memory aids and collecting data, you may need to provide some encouragement and some reassurance to the participant. So you just maybe want to think about if you were in the participant's shoes, somebody laid out 3 or 4 months worth of calendars and said we're going to go back day by day and collect your substance use or any type of behavior that you might have done over that period of time. You may have some initial resistance, some initial hesitance that this is going to be almost impossible to do. So you can provide some reassurance and let the participant know that there is a standard process that we use that aids accurate recollection. So we've got a number of things, a number of memory aids that we can use that will help you remember what's been going on during this period of time. And we also realize that you won't have perfect recall, and that's okay. We're just going to estimate your use during this time, and I'm going to help you and guide you through this process, so we'll work on this together. So those are some things that you can say that will kind of help to set the client or participant at ease before you get going. And then hopefully once you actually start the process, it will become a little more clear to the individual that this is actually a very doable exercise. So a couple additional logistics. Again, you're going to write directly onto the calendar. So the calendar becomes the source document for this particular assessment. As we'll talk about a little later, you may have an additional timeline fallback summary form where you transfer the data from the calendars to another form. But the calendar always becomes the source of the data collection. You're going to complete each day individually. So you're actually going to assess substance use for each day, and you're going to write something on each day of the calendars during the assessment time period. So there are quite a few memory aids that have been developed over the years with the timeline follow-back that have been found to be very helpful in aiding participant recall about what's been going on in their life. And the purpose of the memory aids, and the reason we want to try to get as many as possible and fill out the calendar as much as possible, is that all those aids are going to help people remember and trigger their memory about what's been going on during this period of time, and in turn what their substance use might be like on a given day or a given week during this period of time. So some pretty straightforward memory aids are what we mentioned earlier, holidays and kind of major events. So anything from July 4th, Memorial Day, Labor Day, to events such as sporting events, major political or environmental news stories. You can note religious holidays. And so a lot of these will just help to kind of anchor the participant into what's been going on during this time. And these are fairly straightforward aids to note on the calendar. In addition, you can ask the participant for their own personal or significant events that have occurred during this period of time. So things like birthdays, anniversaries, starting or ending of school for either themselves or if they have children, whether they've been seeing a new person or whether they've been attending self-help meetings on a regular basis. So all these things that are kind of unique to the individual will be helpful to then provide additional context to what's been happening. And then there are things called anchor dates. And these are dates that kind of have a start and an end and that may distinguish periods of either abstinence or maybe more increased substance use. So things like vacations that have a start and an end time that can be noted on the calendar and where substance use patterns might have changed. Other dates with anchors are things like incarceration, inpatient treatment, hospitalizations. And then we can also ask questions about what's called black or white days. So these are days of known abstinence or known use days, and even known binge days, perhaps. So looking at the calendar, are there periods of time where you know you didn't use anything at all? And those can be noted ahead of time. And so really the goal of these different memory aids and why we really emphasize that you want to spend quite a bit of time putting as many of these as possible on the calendar is that they'll really orient the participant to what's been happening during this period of time. So I just want to alert you to one of the handouts that Liz sent prior to this training. Put it up here on the screen for a moment. So this is a 4-page document. It was initially created on the CTN 31 protocol, and it provides kind of some brief instructions about the front end of the timeline follow-back. And on page 2 and 3, it gives some fairly extensive lists of different types of events that you might want to note or suggest to the participant as things that might have been going on during this time. And so this document is helpful in preparing research staff to start to administer the timeline follow-back. It's also a document that can be used on your particular research protocols that you can add to as time goes on for your particular population. You might have some very specific events that are unique to your population that you would want to add to this list. Okay. So here's an example of a calendar looking at a recent week or so of time. And some very common things that people might put on their calendars after we've gone through the different types of memory aids. So you can see things like employment, getting paid. That's a very good event to track because it's often linked with substance use. Things like treatment episodes. So you see that we have some AA meetings listed there. And other types of family appointments or family events. So a son's birthday, shopping with a son. And then a couple of days indicating hanging out with friends or partying with friends. And again, those might be good days to think about, substance use that might have occurred. Okay, at this point, I'd like to pause for a moment and ask John to go ahead and open up the phone lines for a few minutes and just see if we have any questions or feedback at this point.
And all lines are open.
Okay, anybody, if you have any questions or feedback for Aimee, go ahead and speak up now. You are welcome to press star mute on your phone if you do not have any questions while the lines are open.
Is there any additional feedback from folks who have administered the timeline Followback quite a bit? Any additional tips to throw out there?
All right, Aimee, I'm going to assume that they're fine and encourage you to proceed.
I don't want to comment.
Right.
Would you guys want to?
Can we go ahead and close the phone lines again?
One moment. And all lines have been muted.
Thank you.
Great. Thank you, John. All right. So let's proceed with talking a little bit more about some interviewing strategies and moving on to actual collection of substance use. So additional things to think about after you've gotten your calendars all completed with events that have occurred during this time and you've kind of gently pushed the participant to remember anything additional. You can actually choose to start working from yesterday backwards, or you can choose to start at the beginning of the time period and work forwards. And either one of these methods work. It's really dependent on your own personal style and technique and what usually works best for you, as well as what the particular participant that you're working with brings. So, for example, if someone is very hesitant about the task, they're really voicing that this seems impossible to do, and I don't even remember what happened, 2 days ago, let alone 90 days ago, it might be helpful to start with yesterday in terms of what a participant was using, and to start to go day by day with recent use to give them the sense of, yes, you can kind of, once you start thinking about it, it does become a little easier to recall what you've been doing, and then to really utilize the memory aids that have been noted on the calendar. If a participant kind of automatically starts with 90 days ago and is ready to jump in and start from there, that's totally fine as well. So again, it really depends on your own personal preference as well as what might work best with a particular client that you're working with. So in addition to going day by day and getting very specific daily use, you can also make use of standard weeks or regular patterns of alcohol and drug use. So for example, a participant may have a very regular work pattern, a really regular relaxation pattern, and they may, smoke marijuana every evening of every day, and on the weekends they also use alcohol. And that might be a very standard pattern for this participant throughout the time period. And so you can note a standard week on the calendar, and then you can start going week by week and asking the participant if that would have been a standard week, or if there was anything about that week that might have made it a little bit different. And again, the more memory aids that you've listed on the calendar, the more precise that data is going to come as they think about, well, that was actually not a standard week because this event occurred, or I had a doctor's appointment that day, and so I didn't use anything the day before. It's perfectly acceptable to consult a date book if a participant or client has that available. They can pull that out and they can note events that have occurred during that time onto your calendars. We want to refrain from asking the participant to continue to track their use on a calendar. That can be more in the line of an intervention, and so we don't want to ask participants to do that. But if they do keep a regular date book or schedule, that's perfectly fine to pull out and utilize. And then we often make use of the phrase, give it your best guess, or what's your best estimate as to whether or not you used that day or how many alcoholic drinks you might have had that day. And so although we try to be as precise and as accurate as possible in recall, we know that there's going to be estimates during the 90-day or a 120-day period. And so if a participant is having trouble coming up with a very specific number, it's just fine for the interviewer to tell them to give it your best guess. Well, what's your closest estimate as to what that use might have looked like on that day? So now let's talk a little bit about collecting alcohol use specifically on the timeline Followback. So the goal in collecting alcohol use on this measure is to collect the number of standard drinks on each specific day. So for days that there wouldn't be any alcohol use, you could enter a 0. And for days where there was any use at all, you would want the participant to estimate the number of standard drinks that they would have had on that day. Now we use standard drinks because it obviously will promote consistency across assessments with that particular participant. It will also promote consistency across participants in a given trial. And standard alcoholic drinks are just that. They're fairly standard across states and countries. And I'll just alert you to a material that Liz sent out prior to this training, the standard alcohol drink handout. And so what we'll want to do with participants is utilize a visual aid to help them define what a standard drink is. And so you'll actually show them a standard drink card, and it could be the one that we sent out in the materials, or it could be one that you've developed at your site, or there are a number of different standard drink cards that are also available. There's one from NIAAA, for example, that's also nice. And you may want to alter the standard drink card for specific types of amounts or specific types of beverages that might be more prevalent in your population as well. So you're going to show the participant the standard drink chart, and you're going to say, we want you to estimate your alcohol use in terms of the standard drinks you had on that day. And this is what we mean by standard drinks. So, for example, 12 ounces of regular beer would be one standard drink. 5 ounces of wine would be a standard drink. And about 1.5 ounces or one shot of hard liquor or spirits would equal one standard drink. And usually participants have a fairly easy time of getting these definitions. They're fairly standard, and it's usually what most people kind of think of as a drink. You do want to be careful with mixed drinks or drinks that have a specific recipe that might have multiple types of liquor into it. Mixed drinks can have anywhere from 1 to 3 standard drinks or equal 1 to 3 standard drinks, and so you do want to kind of be clear as to what the participant is drinking. When they say I had one mixed drink, you might want to clarify and say, well, was that one shot of liquor in that drink, or would there have been more than that? So again, we share the standard drink card with the participant, and they can use that throughout the remainder of the assessment to help remind them what it is we're talking about. So a few additional strategies for collecting alcohol data. Oftentimes we'll want to establish boundaries of use, and this can be done on the front end of the assessment. So prior to even collecting data, you might say, well, taking a look at this time, what would be the least or the most that you drank during this period? And sometimes thinking about it in those terms will help participants or clients kind of think about, well, yeah, there was that time a couple of weeks ago where I really had more than I usually drank, or there was a day a couple of weeks ago where I know I didn't have any, and that was unusual for me. So it just, again, is another way to kind of contextualize what might be happening during this period of time. Another important technique for collecting alcohol use is to use exaggeration. So it's not uncommon for a participant to say, well, I drank a lot on Saturday. Who knows how much that might be? Or I have no idea. After 5 drinks, I lost count. And so one way that the interviewer can kind of help rein the participant in to provide an estimate is say, well, what does a lot mean? Is a lot 12 beers or is that 2 beers? And typically the participant's going to say, well, a lot for me is, well, that's going to be much closer to 12. And then you can kind of ask them, well, what would be your best guess at this point then? If you had a lot to drink, it's probably closer to 12. Estimate how many standard drinks you might have had. And those are a couple of techniques that can kind of be helpful in supporting the participant and helping them to provide an estimate. Okay, so for collecting drug use on the timeline follow-back, it's a little different from alcohol use. Typically, the goal is to have a yes or a no for any specific substance use on a given day. And this can be for drugs in general, or it can be for each specific type of drug. And this really depends on the research protocol in which you're working on and the types of data that are being collected. So the most common thing is to have a list of substances that people might use and to note each of those substances on a day if it was used. So, for example, on August 4th, I used marijuana, cocaine, and 10 benzos, and those are listed, actually listed each of those drugs on that day. Now, for marijuana and cigarettes, again, depending on the protocol, you might be asked to estimate the actual amount of both marijuana and cigarettes on a given day. So for marijuana, the timeline follow-back looks for estimates of the number of joints that would have been used on a specific day. Now, of course, we know that individuals may use marijuana in a number of different ways, may not use joints, may in fact use a pipe or a water pipe or something like that. But you'll ask the participant to estimate, well, if you took the amount that you smoked in the pipe and rolled it into a kind of a normal-sized joint, how many joints do you think you would have smoked on that day? And usually participants are familiar enough with the amounts of marijuana that they're smoking that they'll be able to convert that. For cigarettes, you'll actually want the number of cigarettes smoked per day. And again, that will likely be fairly standard across time unless somebody is trying to quit or reducing the amount that they're using. And again, you'll put the number of cigarettes next to the fact that they smoke cigarettes on each day. An additional piece of information that's often collected is the route of administration for drug use. So those of you who are familiar with the Addiction Severity Index, you can often use that same notation, and you'll write next to the drug that's listed on the calendar how it was used. And so commonly you can have oral use, nasal use, smoked, non-IV injection, or IV injection. And if there's more than one route used on a given day, you typically list the most invasive or extreme. So if someone smoked heroin but also injected it, you would usually list IV injection for that day. And again, this will be protocol specific. Some studies may not collect route of administration on this particular measure, but it certainly can be done in the context of collecting drug use information on the calendars. Okay, and like the strategy of whether to start with yesterday or whether to start at the beginning of the assessment time period, the order of data collection really is dependent on the client themselves. So depending on the participant's pattern of use, you can start with alcohol and collect alcohol for the entire period of time, or you can collect alcohol and drugs simultaneously. So, of course, if somebody is primarily an alcoholic with just a smattering of other substance use, those might easily go hand in hand. If there's a pretty standard alcohol use during a period of time, you might collect alcohol use first and then use that as kind of a trigger for other substance use. So it really depends on the client themselves and what you feel as the interviewer is going to be most efficient. So, for an example, a participant only drinks when they use cocaine and they're a primary cocaine user. It might make sense to simultaneously collect that data together. Okay, so the next slide just shows another example of a calendar that we're actually using on a current study that I'm working on. And you can see that the calendar has been pre-populated with some data already there or space to note substances that are used. So again, we have alcohol use is here, and you can actually note yes or no, was alcohol used, and then, of course, if yes, then you would note the standard drinks. And then were there other substances used? Was a drug used on this particular day? And you can note yes or no. And if yes, then you would circle the specific type of drug that was used on that day. And so pre-populating the calendar like that, it does give some structure to the interview so that you know you need to have a yes or a no for alcohol and drug use on a day. And you know if it's a yes, you need to then specify exactly the amount or the type of drug that was used. And again, you can change the types of drugs that are being collected based on your particular protocol. Okay, so before we move into just a short demonstration of the timeline follow-back, which Liz and I will do, John, I'll just ask you to open the phone lines real quick again and see if we have any questions or feedback or comments about the information that we've gone through so far.
And all lines are open.
Any comments or feedback on this material that's been covered thus far? Okay, Amy, I think we can continue. John, can you go ahead and close the phone lines, please?
And all lines are muted.
Thanks.
Okay. Great. And as we'll talk about a little bit later, the questions really come up as you kind of sit down across from a participant. So once you start practicing this and working with actual clients, then you can email me later with all the questions that you have. And I'll give you my email address at the end. So Liz and I are going to do just a brief demonstration of about a week of timeline follow-back. And I just want you to pay attention to the introduction, the memory aids, and then the collection of recent use data. And then after the demonstration, we'll actually show the completed calendar, and you can take a look at how well you did. So Liz sent around a blank demonstration calendar with the materials prior to the training. So if you have that available and want to pull it out now and you can code along with the interview that I'll do with Liz, that would be great. And then we can take a look at the completed interview here in a couple of minutes. A moment to get that out. Okay, and Liz, are you ready?
I am ready.
Excellent. All right. Well, thanks for being here today, Liz. The first interview that we're going to do today is called the Timeline Followback.
Okay.
And the Timeline Followback utilizes actual calendars for us to track your substance use over the last 9 days. So I'm going to put the calendars out here. And there are a number of ways, there are a number of strategies that we can use to help people recall or remember what's been going on during this period of time that will really be helpful in getting you to think about what your substance use might have looked like during this period. This is going to take just a couple of minutes for us to do for the last 9 days. And I just want to remind you that any information that you provide is going to be kept strictly confidential. It's not shared with the treatment program that you're attending.
Okay.
So any questions before we get started?
No.
Okay, great. So here's the calendar, Liz. And as you can see, we're going to go back to Sunday, August 1st, and we're going to collect your substance use up through yesterday, Monday, August 9th.
Okay.
So the first thing that kind of helps to make this a little bit easier is to maybe note any events that have occurred during this time. So anything that's specific to what's been happening in your life, birthdays, anniversaries, doctor's appointments, get together with friends, any trips that you might have taken during this period of time?
We had a family picnic on the 1st.
Okay. So Sunday there was a family picnic.
The next day I decided to start treatment.
Okay, so on Monday you started treatment.
Yeah.
Okay.
I worked for half day that day.
Okay. What's your employment like during this period? Were you working daily or?
No. So I worked a half day that day.
Okay. What other days might you have worked?
I worked a full day the next day.
Mm-hmm.
I did a half day the following day. I didn't work on the 5th, but I got paid on the 6th.
Okay, so Friday the 6th was a payday?
Mm-hmm.
Okay.
I worked on Monday, on the 9th.
You worked on Monday. Okay.
But only for
so
half
yesterday you worked
yeah,
half day on Monday the 9th. Okay. And you said you started treatment on Monday the 2nd, and would you have attended treatment on any other days during this period?
Yeah. The next day I had an AA meeting.
Okay.
And after that I had treatment group.
On Wednesday?
Yeah, on the 4th, yeah.
Okay.
And the next day I met with a counselor.
Wednesday and Thursday you had treatment?
Mm-hmm.
How about yesterday? Any treatment visits yesterday?
I had an AA meeting and kind of a group counseling session.
Okay. Right. And any other events during this time where you may have hung out with family or hung out with friends?
Well, I saw my mom and my son yesterday.
Yesterday on Monday?
I'm sorry, on Sunday.
Okay. So you hung out with your mom and your son on Sunday?
Mm-hmm.
How about when you got paid? Did you go out at all or anything on Friday or Saturday?
I partied with friends on Friday night and Saturday.
Okay. So party both Friday and Saturday.
Mm-hmm.
Okay. All right. Anything else during this period that you can think of that might have gone on?
No.
Okay. This is great. This will be helpful in thinking about your substance use. And so just looking at these 9 days, are there any days on the calendar that you know you wouldn't have used anything at all, where you might have been totally abstinent?
I was abstinent on the day I started treatment, on the 2nd.
On the 2nd? So wouldn't have used anything that day?
Yeah, nothing.
Okay.
And I didn't use anything this Monday either, on the 9th.
Yesterday?
Yeah.
Okay. Okay, and what types of substances might you have used during this time? What do you typically use?
Pot. I drink.
Okay.
I sometimes take some Valium to sleep.
Okay. Okay. Well, let's start with the most recent days. We know yesterday that you didn't use it all. How about Sunday, when the day that you saw your mom or son?
I smoked some pot before I went.
Okay.
I came home and had about 3 beers. I couldn't sleep, so I took a Valium.
Okay. So a little, smoked some marijuana before you saw your mom and son, and then when you got home, you had about 3 drinks and Valium later to help you sleep.
Yeah.
Okay. Now with alcohol use, I just want to show you this, what we call a standard drink card.
Okay.
And so on days that you would have had alcohol use, what I'd like you to think about is how many standard drinks you would have had. And so, for example, with beer, 12 ounces of beer is going to be 1 standard drink. And with wine, 5 ounces, or kind of a regular-sized glass of wine, would be the equivalent of 1 standard drink. So on Sunday, when you said you had 3 beers, was that 3 bottles of beers, cans, or larger?
Yeah, it's just a regular bottle of beer.
Okay. Okay. And then how about Saturday? You said you had partied with friends?
Yeah. So I drank 2 bottles of wine.
Okay. Were those kind of the regular skinny bottles, standard bottles?
Yeah, regular bottles.
Okay. Anything else to drink besides that?
No, not on Saturday. We got some Coke on Friday. It's payday, so I did some Coke.
So cocaine on Friday, and did you also use it on Saturday?
Yeah.
Okay. Would you have used anything else on Saturday besides cocaine and the couple bottles of wine?
Well, I had some pot, and I couldn't sleep again, so I took some Valium to go to sleep.
Okay. And how about Friday? You had some cocaine. Would you have also had alcohol?
Yeah, I had about 8 beers.
Okay. And would those be kind of the standard drinks that we're talking about on that sheet?
Mm-hmm.
Okay. And any other drug use that day besides alcohol, cocaine?
I smoked some dope that afternoon, yeah.
Okay. So let's look at last week. We know on Monday you started treatment and you didn't use anything at all. What might your use have looked like on Tuesday, Wednesday, and Thursday? Were you drinking on those days?
Tuesday and Wednesday I didn't drink anything, but it's just in my regular pot.
So marijuana both those days?
Yeah.
Okay. How about Thursday? You went to treatment
Thursday I had about 3 beers.
Okay.
And I had pot on Thursday too.
Right. And how about Sunday, the last day of this assessment period? You had the family picnic. What might you have used that day?
Well, I smoked some pot before we went. I had about 3 beers while I was there, and came home, took a Valium, and went to bed.
Okay. So 3 12-ounce beers, standard beers?
Yeah, just regular beers.
Okay. And a little marijuana before and a Valium in the evening.
Mm-hmm.
Okay. Great. Well, thank you, Liz, for working with me on this. And so just taking a look at these calendars, it looks like you used about 7 of the last 9 days, or a couple of days where you didn't use anything at all. Marijuana on most days, a couple of days of cocaine use and Valium use, and about 5 days or so of alcohol use. So just take a look at that. Does that look about right? Is there anything that doesn't feel right about the use that you estimated there?
No, that's right. That's right.
Okay, great. Thank you very much. Okay, so there's a quick demonstration of very recent substance use. And again, just thinking about the introduction and the memory aids. And in terms of the introduction of the timeline follow-back, this is something that you really want to make your own. You want to have kind of your own script about how you introduce it. Again, it'll depend on some of the specifics of the particular research protocol that you're working on and your experience with the participant in the past in terms of whether they've had an easy time or a challenging time with this particular measure. So now I want to put up the calendar as it should have been noted. So these are the notes that we took during this demonstration. So take a look at this and see whether or not it matches to what you've been coding. As you can see on the bottom, we've noted a few of the events that Liz pointed out. We started with kind of unique personal events. We talked about employment, income, treatment, which can give us some anchor dates. And then we simultaneously collected alcohol use and drug use during this period of time. Other ways that you could have gone about it certainly are, it looks like marijuana is a pretty standard daily substance that's used. You could have talked about that specifically outside of other substances. That would be another way to address this pattern of use. Okay, and then I'll just, one more note on this is Saturday, Liz mentioned that she drank 2 bottles of wine. I clarified with her what types of bottles of wine those were. And we know that a standard bottle of wine, which is 25 ounces, is equal to about 5 standard drinks. And so I went ahead and just calculated that on my own. And that's fine to do. You can either note the 10 standard drinks on the calendar at the time, or you can note that there was 2 regular bottles of wine, and you can go back and put the standard drinks in at another time if you want. And so if you get measures like that from a participant, it's perfectly fine for you to go ahead and do the calculation as long as you're very clear on the quantity that was used. Okay. Well, let's just finish up with a few remaining slides here. So again, we mentioned the timeline fallback summary form. So in doing data entry with the timeline fallback, you certainly can enter each day that's collected on the timeline fallback into some type of a data entry system or database. Or you can use a summary form, and you can generate a variety of variables based on the information that's collected on the assessment, and you can easily summarize information from the calendars to match research study objectives. So, for example, you can put a total number of days used during a specific time period, the routes of administration, the frequency of use, etc. For alcohol use, you can put the total number of days used. You can put the number of standard drinks per drinking day, so what was the mean number of drinks when they actually did drink. You can calculate the number of heavy drinking days, which is also a common variable that's used in alcohol research. So heavy drinking days are usually 4 drinks per episode for a woman and 5 for a man. And again, this will just depend on the objectives of the particular protocol in which you're working on. A couple of common errors on the timeline fallback that I wanted to point out. I mentioned earlier providing the wrong data collection time frame is a very common error. It's very easy to count back 89 days instead of 90 days. And so this is something that you want to be very careful with at every administration of the timeline fallback, especially if you're working on multiple protocols, for example. You may have different assessment time periods that you're working with. You want to make sure you have the accurate one for that particular research visit and that it's accurately reflected on the calendar. Handwriting, of course, needs to be legible, and the rule of thumb here is that if you filled out a calendar, another research staff person should be able to look at that calendar and know exactly the use for each day. And so along those lines, you want to avoid uncommon abbreviations or symbols. If you're going to make abbreviations for different types of drugs on the calendar, you'll want to have that specified beforehand and have that be a consistent standard list at your site. And very importantly, and which can happen quite a lot in terms of drift away from the standard procedures for the timeline fallback, is that you don't want to skip parts of the interview process or parts of the interview strategies that we've talked about. So after you've done a number of these administrations, oftentimes your introduction will get quite short. You'll allow the participant to get away with just a couple of events on the calendars, and you'll move directly into collecting substance use. And this actually kind of can take away from the precision and accuracy of the data that you're collecting on the timeline fallback. The unique aspect of the timeline fallback is the calendars and the memory aids. And the more memory aids and events that you note on the calendar, the easier it's going to be to collect accurate estimates of substance use during this period of time. So although it can be very easy to kind of shorten the front end in order to get through your interview quicker, it's very important that it's given just as much import as the actual data that's collected. This slide just is kind of a cheat sheet of timeline fallback administration. These are the kind of specific steps that we've talked about during this training, and you'll want to make sure that you hit each of these each time that you administer the timeline fallback. So anywhere from preparing the calendars and confirming data collection down to the different strategies prior to actually collecting the alcohol and drug use. And then finishing up the interview with a summary and check-in with the participant to make sure that this accurately reflects and looks right to them in terms of their use during this period. And then practice. So competent administration of the timeline fallback comes with practice, and there's no substitute for actually administering the interview. I know in my experience, it's challenging, and you don't have a lot of confidence at the beginning. You sit down with a participant who might be very resistant to doing this, or might be very overwhelmed by the prospect of talking about their very specific use over the last 30 or 90 days. And the more that you're comfortable with the procedures, the more time you've had with different types of participants and mock participants administering the timeline fallback, the easier it's going to be for you to reassure the participant and to be confident that you can actually guide them through these procedures. And that's going to make the biggest difference in terms of working with participants. So to prepare for studies, we recommend that you practice multiple times administering the timeline fallback, and really as much as you possibly can before seeing the first participant, and that this be done with a third person or a supervisor observing so that they can give you feedback on your technique and different strategies that you could have used. And that's kind of the end of our the formal content of this training. Appreciate your time today, and I just want to let you know that you're welcome to contact me with questions or comments. My information's there, and I wanted to make sure and note the numerous references to the timeline fallback, both manuals as well as other studies that have been done with different populations in looking at the psychometric properties of the timeline fallback. So I'll stop there. If we have time, Liz, I'm happy to open the phone lines again and see if there are any final questions. I know we're right at our hour time limit.
Okay, Amy, let's do a real quick question check. John, can we go ahead and open up the phone lines for a moment?
And all lines are open.
Sorry, not a question, but we have a couple of people who joined the conference after you had already taken the initial names.
Okay, that's fine. You'll show up on the attendance report.
Okay. The two names are Donna Daskal, DONNASTEJSKAL. The second one is Donna Rasmussen, DONNARASMUSSEN.
Okay.
And I wanted to add Sabrina Poole and Delaware Valley. We never did get on the web, but we were listening on audio. We could not get in.
Okay, Sabrina, it sounds like you're in a group of people. If you can go ahead and send me an email with the list of people who are in attendance with you, I'd really appreciate that.
Thank you.
Anybody have
any final questions? All right. Well, thank you very much. I appreciate your attendance today, and good luck with your timeline Followback experience. And again, please don't hesitate to contact me if you have any specific questions about the training today.
Aimee, thank you very much for presenting for us today. This was a recorded session, and it will be available on the CTN Dissemination Library as well as on LiveLink. If anybody has any questions related to the timeline Followback, I would refer you to speak with Aimee Campbell, Frankie Kropp, or Rabrina Walker, depending on which protocol you're administering the timeline Followback for. I hope you guys have a great day, and we will see you for the next webinar, which will be the Addiction Severity Index. It's the Makeup Seminar on the 18th of August. I hope you guys have a great remaining of your summer. Thanks. Bye, everybody.